joining us again today for another great episode of Small Biz Spotlight 210. I am Lidia Rodriguez. So today I have another great episode that absolutely is for everybody. And something that we all need to think about is health and life insurance. So today I have Kayla Holloway. And she has her own little business, small business, and it's called Health and Life Insurance Broker. Mm-hmm. So let's go ahead and do me a favor, please. Give me a like, give me a subscribe to these videos, please, because it really does help me out. And if you would please stay till the end of the video, because I do have some more important information to share with all of y'all. Okay, so let's get this episode started. All right, Kayla, tell me your whole story, your name, everything.
Okay, thank you so much for having me. I'm super excited to have this conversation with you and hopefully give some good information to everyone at home. So like you said, my name is Kayla Holloway. And my business, my agency is Holloway Health and Life Benefits. And I moved to San Antonio. Oh my gosh, it's been almost 2 years at this point.
Okay.
Can't believe. It feels like yesterday and a decade all at once. I'm from the Beaumont, Texas area. That's where I spent my most of my life.
I hear it's beautiful over there.
Yes. So I was born in Florida. Oh. And I moved to the Beaumont area when I was around 4 and lived there until 2 years ago. My background is in academic advising. I worked at the local university there in Beaumont, and when I made the transition here to San Antonio to be close to family and to be with family in the area, I needed a remote position. And I also was looking, to do something different. I had been in higher education for over a decade, and I really was drawn to insurance. I had recently just helped a family member get an insurance policy and transition actually into Medicare. Actually, it's what started my whole journey into this world. And I really was intrigued with how similar it is to academic advising. You're just still helping someone through a process. It's just a different topic of the process.
You must be like super detailed oriented to have that kind of job. Yeah. Because like when I think about health and life insurance, it's always changing. Yes. And it's a very confusing, kind of difficult thing to just learn about it for your own self.
Exactly.
So you went through all of that just for us.
Well, I think that is what drew me to it. I really love puzzles and figuring things out. And I think that's what gets me excited and gets me passionate about it. But then also, the second part of that passion is then also helping others. It truly is what drew me to this profession, but also what is keeping me here. Hearing the stories of my clients of not understanding their policies or the horror stories that I've heard and recognizing that I can help them is truly the mission that I have for this role, and trying to help demystify this process for everyone.
Yeah, because it's super confusing.
It's super
confusing. You think you're getting one thing and you think you're covered, and then you're not. Or every year something changes.
Absolutely.
Is that right?
Yes, it definitely can. Every year, especially with health insurance, each individual insurance company, every year they have the ability to make changes to every plan. That's why it's very important to meet with your agent or broker every year, because every year you want to just keep your same plan, but you don't know what your policy potentially may have changed. Your doctor may no longer take the plan, or they made a small slight change and you're not aware of a new policy that came out, a new plan that's available, or maybe something changed and you're not aware of it. So it's very important that you do a kind of an audit and a refresh. And it very well may be great to keep the same plan,
Right.
but you just need to confirm that.
Just to make sure that what exactly you wanted in it is still in it.
Exactly, because they can change it.
God, that's kind of like something we really, really need to do every year.
Yes, every year they have each insurance company has the ability to change the terms of their policy each year.
So, okay, for this, well, let's start with life insurance.
Sure.
Okay, because talking about both,
yes,
I'm going to confuse myself.
Sure, let's start there. Okay.
So let's talk about life insurance first.
Perfect.
Okay, so can you tell my viewers, why do we need life insurance?
So one of the great things about life insurance that I think I really want to mention about to your viewers is, if you think back to our grandparents' generation or even before, I think many of us think of life insurance as serving one purpose. When you pass away, your beneficiaries, whomever you choose, get a lump sum payment to, and many people that when I meet with my clients, many folks think it's just money to bury me. And that's definitely one piece.
Yeah, that was exactly my next question was like, it's not just for funeral expenses.
Definitely not. It is absolutely one huge component and one of the main drivers that many people think of why they need it. And absolutely, weddings and funerals are definitely those two industries. Folks have recognized that you have access to larger sums of money, so things can be really expensive. So that definitely is a huge need, but that's not the only need. Especially think about for those who have small children, or you have a large set of debt that you're going to be leaving. That's a burden that you're leaving to someone, right? A financial burden. Obviously, if it's children, there's emotional burdens and all the other things, but if you're looking at just a financial picture of that, someone is needing to take care of your children or take care of the debt. Maybe that's a home, or even animals nowadays. We have pets that are needing to have the financial, the longevity to take care of them. So you're needing to think in the terms of not only paying for your funeral, but for whatever the vacuum has been created. And so that's something that we as brokers are able to sit down with our clients and go through your individual scenario in life and project what your needs are, because that's the other component, is many people don't know what their needs actually are because you're not really looking at it from that perspective. So
yeah, there were several episodes before. I hope y'all remember Yvette Salinas, who did the whole wills and everything. So okay, guys, this is where my brain is at right now.
Sure.
So, okay, like the lawyer will do the whole I leave, I bequeath, and all of that. But then we're not thinking about what it is to keep that, or right after you pass away. So the life insurance is what kicks in.
Exactly.
To help them, if you're leaving them the house or the car, something to help them along with that.
Absolutely. So the way I like to explain it is the life insurance is the funds in order to make whatever you put in your will possible. So the life insurance funds it. What you put in your will is what you are intending and how you want those funds to be utilized. So they are two very important components, and they need to be utilized hand in hand. So think about, let's use an example of a 30-year-old single mother who has 2 children. She passes away tomorrow, and she has an 8-year-old and a 10-year-old. It's not only that she needs $200,000 life insurance policy. That is absolutely potentially what she would need, but we would need to look at her finances and what's needed. She has 2 children that are going to need 8 and actually 10 years worth of, being taken care of.
Yeah, some kind of financial support.
Exactly.
Or whoever you entrusted them with to help them to raise them.
Exactly.
Wow.
And then the will is explaining this and how to do it.
Yeah, because I'm like many of y'all, I just thought it was just to help you bury, and I thought I had it covered.
Absolutely.
I'm gonna have to
rethink that. Yeah. Well, the other great thing about it is that in addition to those things, that in the past 20 years, life insurance has also become a very great tool to help beyond just the things we've already talked about. There are other ways to utilize your life insurance to be utilized as a tool while you're still alive. That is the other big misnomer that I really want your viewers to understand, is that it's not only to be utilized after you pass anymore. There are options that many people are utilizing their life insurance to supplement their retirement, and it is a very interesting opportunity that there are ways that you can utilize cash value in your life insurance policy to fund college for your children. You can it's taking out loans against your life insurance policy, and we can definitely go into much more detail with you later with that. But there are just so many other really interesting ways to utilize and think about your life insurance that we like to use the analogy of thinking about a phone. Back when Alexander Graham Bell came up with it, it was one exciting thing. You could talk to someone way far away. Now think about all the different ways we use a phone, and it has become such an integral, tool in our lives that talking to someone on the phone is one of the least ways we use that tool.
Yes, definitely.
And so that's the thing, that it is still obviously a very important component, but there are so many other benefits. Living benefits is another great thing that you can utilize. Getting access to a portion of your death benefit if you yourself have a critical illness that you have, diagnosed with a terminal illness or cancer, and you need access to treatment or how to, live because you can't work. And you can access a portion of your death benefit ahead of time now if you get the right types of policies and things. So
I wish I had this several. Oh my gosh, I think I'm going on my 10th year anniversary. I survived leukemia.
Oh wow.
And it was really tough because you have to make a choice. Do I dig into my 401k?
Exactly.
Or, just like live really minimally.
Exactly.
So this would be a good idea, guys, if you don't want to get into your 401k, or if life insurance would be a lifesaver for that.
Absolutely. And it definitely is one of those things that it can be a very versatile thing. That do you need it because you're going to pass away before you, obviously we all intend to live until our old age. And so if you're going to pass away early, you have this lump sum that your beneficiaries can get. If you are going to live longer and you have a terminal illness, then that same policy can get turned into something that's going to help you. So it's a very versatile thing that it is one policy that can be turned into multiple things. If you're going to live long enough and you need it to help supplement your retirement, it can turn into that. So it's a really great tool, and that's what I love about it, is that it can really change depending on how you're going to utilize it. Yeah, So what age would you even suggest you should start a life? Definitely as soon as possible. At infant stages, people are starting it because of the fact that I did a life insurance quote for a 4-year-old child, and with the policy type that I'm explaining to you, his parents would have paid in about $74,000 over the life of his policy when he turned 65, and he would have a little under $500,000 benefit that he would have access to turn into a supplement to his retirement at that point. So it is one of those things that, we are looking at projections with that, but if you're looking at paying into something for over 60 something years, it's the time value of money and compounding interest and different things like that that definitely give you that idea of time. And it's something that you aren't necessarily seeing value from a life insurance, but when you're realizing that you have this ability to make it malleable to what you need it to be, if that child were to have passed away at the age of 12, he would have had a large life insurance policy, but then the projection of living to the age of 70, he also had, $500,000 that he could have utilized to help supplement his retirement. So it's definitely one of those things that you can utilize for saving for a child's education, for their college education. If you start saving when they are born, and by the time they are going off to college, they could have $30,000 in this fund that they could use, that they could access some portion of that to help fund their college education, different things like that. So that's why I definitely think that having conversations with clients individually, what are their ultimate goals and their needs. It's not a one-size-fits-all. Having a conversation with someone who's not married, has no dependents, have no one in their family, that is a very different conversation from someone who has 3 children and a house, and all of those things. So it really does depend on each individual client and what their values are and what they see as important, and a legacy versus just making sure grandmother gets her funeral paid for, So that's why it's very rewarding to get to sit down and have a conversation with each individual client to see what they need, and then let's go look at it. That's the other beauty of being a broker is I work with many different insurance companies, so I get to go do the shopping and get to go do the comparison and say, this looks like this would be a better fit based on what you've told me your needs are.
Oh, that's
and
nice.
so,
Yes.
That's
yes, because I see that as daunting, but if you love it, I'll rather you do it.
Exactly. Well, I get to understand the details, and then based on what the client's explaining to me, I'm able to kind of take the 100 different options and pare them down to say, okay, because that's the other beauty of what insurance companies do is they recognize, let's build policies based on what different people need and what their values are, so that they can have those policies fit different clients. So.
That's remarkable. I love that. I really do. Helping that service is helping so many people because I think like for a lot of us, it's just so confusing and so daunting that we just say, and we could be missing out on something very helpful later on.
Absolutely.
Okay, so the next thing is for health insurance. Health insurance right now, well, a lot of us are putting it off. This is another very confusing thing.
Sure.
Another very daunting thing to just even begin. Okay, so what health insurances are you affiliated with?
So I'm a broker. Again, that means I work with multiple different insurance companies. So therefore, I am contracted with over, I think, like 37 different insurance companies.
Wow.
Across health and life. So I like to say I work for my clients, and I make sure that I work to find the different areas. And in addition to that, another reason why I'm affiliated with a number is because I'm not only licensed in Texas. I have my license in 19 different states.
Oh, wow.
So I'm able to help folks not just in the state of Texas, although obviously the bulk of my clients are in Texas, I definitely can help.
So
others.
if any of my viewers have family members that are outside of Texas, you can help them.
Absolutely. Yes, absolutely. And for the most part, I can work in any of the states. I just would have to, get licensed in that state. But the main thing is working with the insurance companies in the area. There are a lot of things that are, nationally is going to be the same. But then there are going to be state-specific and regionally specific things. So that's why we do have to have our license. Not only do we have to have it to work in any state in the United States, but licenses are specific by state because they do have different levels of not only laws, but also, each individual insurance company, they actually can go down to the zip code of where they will offer.
Wow.
Yeah.
I didn't know.
Exactly.
No, is that all part like with the marketplace, or is that something different?
So I work with the marketplace. So any of the different insurance companies that work on the marketplace, I definitely work with the marketplace. But then I also work with plans and with companies that are not on the marketplace. So just to give a little bit of context of what that means, especially to your viewers that may not understand
for
that.
me, I don't understand.
Sure. So just so that everyone knows, back in 2012, really in 2014 is when it got really started being implemented. But the Affordable Care Act was passed, and basically since then it has been more and more. The idea is that trying to get access for the Americans who do not have access to insurance through their employers. So when you think marketplace or healthcare.gov, what you're thinking of is that is where the federal government is trying to provide access and an access point to those of us who do not have an HR department. You can call up and say, where are my options, right? So they're trying to streamline a process that Americans can have access to health coverage. So that's when they tried to streamline it. But also a part of that law that was written was a few things that are key, so that if you're thinking of a marketplace plan, that means that they have to, any plan that's offered on the marketplace or healthcare.gov, they have to meet certain criteria. And one of those criteria is that they cannot exclude based on any health questions. So we call that medical underwriting in insurance. So if you are too ill to qualify.
So that's like pre-existing medical.
That's what I was going to say. And the second is pre-existing. So pre-existing medical conditions means that the insurance would let you get the insurance policy, but they wouldn't pay for any pre-existing medical conditions. So that's two very confusing, but a little, they feel very much the same. But underwriting means we won't let you get the insurance plan at all. Where pre-existing conditions, which sometimes the underwriting would say, because you have a pre-existing condition, we won't let you get the policy at all. But there are situations where they would let you get the policy, but it means because you had shoulder surgery for 12 months, we will not pay for anything, any doctor visits or surgery or physical therapy or anything to do with the shoulder surgery.
Right.
That's a pre-existing condition. You had it before you got this policy. Versus because you had that surgery, we won't let you even get this insurance. That's the two differences. Both of those things were eradicated for the Affordable Care Act. So no policy that is sold on healthcare.gov can either tell you you can't get the insurance because of your shoulder, nor can the doctor, or when you go to the doctor for your shoulder during that first 12 months, can they deny you coverage of that for pre-existing. So that's been a huge game changer for many people because prior to the Affordable Care Act coming around, folks who had their coverage through their employer, for the most part, they didn't have to jump through these hoops because that was the beauty of having coverage through group coverage. They didn't look at all the individuals. The whole group got to have all of these benefits. And so that's what the Affordable Care Act, tried to implement, is everyone getting those benefits. So that's...
So that's good.
Yeah, I think that's a good part of it for sure.
Yeah, I definitely benefited from that when I went through cancer.
Many people did.
Mhm. Okay, so what would be your advice to someone who is looking for the health and life insurance? If they have pre-existing conditions or what have you, what advice would you give somebody looking for it?
Sure. So I'm glad you brought that up because that was one piece for the life insurance I did want to point out is that law that I just talked about, that covers health insurance. That has nothing to do with life insurance.
Mm-hmm.
Life insurance still definitely has underwriting and you have to medically qualify for life insurance.
Oh, wow.
You definitely do. So highly recommend how I mentioned you asked when should you get life insurance. You highly, highly, highly need to get life insurance when you are young enough and healthy enough to qualify for it.
Okay.
So that is another reason why don't put off
Yeah.
getting life insurance because there is a point at which you potentially don't qualify for it and you're limited on your options. You could only qualify for very small amounts of coverage, and the coverage that you want you may not qualify for. There is definite cons of that part.
Yeah.
And so many times the way I like to explain to my clients, when you think you need something, by the time you think I need that, it's probably too late because now you already have cancer.
Yeah.
Or something like that.
If you're in the middle of cancer treatment, they're not going to take
They're
you
not going to
for life insurance.
for life insurance only. So I definitely wanted to put that PSA out there for that. But back to health insurance. So for health insurance, there are still some plans out there that are off the marketplace that are private that still do not meet the criteria of the Affordable Care Act laws that people still access, and they would still be held under the pre-existing conditions and having to go through medical underwriting and things like that. People choose to do those because they typically are less expensive, because if I could medically qualify, that means I'm less of a risk for the insurance company, so they're going to give me a pretty big discount. So many people, recognizing that that is necessary, they need to go that route. The second thing about on the marketplace is the other huge piece of the Affordable Care Act. They implemented the tax subsidy, the tax savings that I definitely want to make sure everyone understands, that it is based on your household size and your family's income, that you potentially can receive a tax subsidy. That means that if you paid your entire bill for your premiums each month, when you go to file your taxes at the end of the year, you would get a refund, just like we always do.
Oh, okay.
But what, understandably, trying to get access to insurance for Americans, the idea for that subsidy is that instead of you having to pay out of pocket throughout the year and then getting that savings back, the government has a program where they try to help you project what you're going to earn throughout that year, so that you can get what's called an advanced tax credit. So if you know I'm going to earn $40,000 this year and I have 4 people in my family, we can do the calculations to say, okay, then we know you're going to, anticipate X amount in your tax subsidy, so we can let the government know that ahead of time, and instead of waiting till the end of the year to get that, what they will do is they will send that money directly to the insurance company on each month on your behalf, so that you can afford it now.
So it's almost like lowering your payment every month.
That's exactly what it does. So for your family, instead of having to pay $500, because your tax subsidy would bring that down to $100, I'm just using fake example numbers here. Obviously, I'm not giving quotes, but for example, if your tax subsidy would be $400 per month, instead of you just having to pay that $500 every month and then get that $400 times 12 back at the end of the year, the government's saying, okay, I'm going to go ahead and pay United Healthcare that $400 directly on your behalf, and you're going to pay that $100 difference to them, so they get their $500 per month.
Oh, okay.
So that's
That would be super helpful.
Absolutely.
Very, very helpful.
Very helpful. But then it does make very important that you are projecting correctly. Because if you are projecting incorrectly, and then I'm projecting to make 40,000, and then something happens and I get a raise and I'm going to make 80,000, and I don't make those adjustments, well, I no longer am really qualifying for $400 of a tax credit each month. I'm only going to qualify for $200, for example. And that's when people, your viewers, may have had something happen to them in the past where they've had to pay money back.
Oh, you owe it back.
You owe it back if you don't need it.
Yeah.
But the other beauty of working with your broker, right now I'm in the middle of doing this, calling my clients throughout the year to say, we projected, in this example, 40,000. Are you still on track of you're making the 40,000? Did you hit the lottery or something? Or did you lose your job? You know, because it could go either way, right? But if your projection that we have made months ago is not the correct projection, you have a 30-day window to tell, you know, the CMS that that's not true anymore. I need to make an adjustment. And if so, then you're not paying anything back because you're adjusting correctly throughout the year, which is what, you know, they're wanting you to do.
Yeah, then it's super important to have a broker, guys, because you help them through it. You keep everything updated. You call them to make sure that everything is updated and everything is on track.
Exactly, because understandably, when you get your insurance once a year, you're not thinking about it, and you hear me tell you, but then life goes on. So I call my clients every quarter, you know, so every 3 months I'm calling to say, hey, is everything still on track? Are you all right? And if not, then let's make an adjustment right now so that you're not going to get hit with a full year's worth of stuff. So yeah, that's why it's super important. Yeah.
So what do you need us to bring for that appointment?
So if we're talking health insurance and you are going to get your health insurance through the marketplace and we need to make that projection, then we need to understand all of the details of what's going to go in to make that projection. So everyone who is going to be listed on your taxes, because when you're thinking household, that's the other key to this. I really want your viewers to know. When you are talking household, we're talking tax household. Everything's tied to your taxes if you're going to utilize the tax credit. If you're not going to utilize the tax credit, obviously we're not talking about that.
Right. If we're not going to do that and it's straight up health insurance, what do we need to bring?
So if it's just health insurance, then we really need to know about who your doctors are, what medications you're taking, and are there any doctors or medications you don't want to change? Because that's the other key piece to think about insurance is every insurance company has to have a specific medication or a doctor in their network that, you know, is going to take that, or is for example, let's take a cardiologist. Every insurance company is going to have a cardiologist, but it may not be the cardiologist you like, right? So if you want to keep that cardiologist, tell me that so I can find plans that your cardiologist utilizes.
Right. I know that I've know a lot of my family members that have hopped from doctor to doctor trying to find that one doctor that they really love that's really focused on their health. And once they find them, I'm not changing.
Exactly.
You know, I'm not changing. I want this doctor.
Right.
So you have to have that information to make sure that they're covered by the insurance that they're getting.
Exactly. Absolutely.
Okay, and so what do we need to bring for the life insurance?
So for life insurance, I sit down and have a conversation with you about your projection of what your needs are. So a lot of it is going to look at what is your debt. So, and what do you already have in place? So if you already have a life insurance policy or a retirement plan that you would be thinking that you would want to utilize for your legacy or for your family, having access to that information would be helpful so that we can include that into your whole portfolio of a plan. That's very helpful. And then anything that you know that you want to plan for. If you already know what type of funeral you need or want, or anything that we're trying to estimate, what are the costs and what do you already have in place, so that we can see what is the difference there that you're needing to make up with this policy.
Okay.
So yeah.
So how can my viewers contact you for all of this?
So I will definitely make sure you have my contact information to put into the description or anything like that. But my direct phone number, you're welcome to call me. I am from the Beaumont area, so I did keep my old phone.
Oh,
so
okay.
it's a 409 area code,
Okay.
so it's not 210. So I can give my
Yeah,
phone number.
go ahead and say it, and I will have it right here on the screen.
Perfect. So it's 409-617-9014.
All right.
And then my email address is just Holloway Health and Life Benefits @outlook.com. You can reach me, either place. I'm happy to answer.
Do you have any social media?
Definitely, yes.
Okay.
So I have some social media. I have Facebook, Instagram, and I am trying to grow into other areas as well. But LinkedIn, I definitely, you can follow me on LinkedIn as well. And trying to get into a little bit of TikTok or other things like that, but mostly it's Facebook, Instagram, and LinkedIn at the moment, so.
Awesome. Okay, and as usual, guys, I will have her phone number. If I didn't already have it on the screen, I'll have it on the screen, and all her other information will be down in the description box, so you can get a hold of her. So, wow.
It's a lot.
That is a lot. Yes, I'm glad you're here for all of that, because it's super confusing. I hope that this helped any of y'all out there. It definitely helped me. Thank you so much for this.
Absolutely, for sure.
Thank you.
Sure.
Okay, guys. It's not over yet. No. Okay. Let's see. How do I want to do this? Let me tell you first, okay? So if you're already here almost at the end of this video, I want to thank you so much for being here. If you are new to me, I am dedicating this channel to small businesses here in San Antonio and the surrounding areas, and I do not charge for this. I do not, because I know how hard it is for small businesses. So please go ahead. Give me a thumbs up on the video. Keep watching all my videos and subscribe, please. The subscriptions, every time somebody subscribes, YouTube loves it, and it goes out to more people out there. And share, like Brenda Owens always says, right? Sharing is caring, and that's what we want to do. The more people get this information, which yours today was phenomenal. Thank you so much.
Absolutely. Well, I'm just so super grateful to be a part of Women Unlimited, who connected us, and I'm just beyond grateful to connect with small business owners, because that is part of what my passion is. Like I said a minute ago, for those of us who do not have an HR department that we can call up, it's hard to understand how to navigate many of these things as small businesses.
Right.
And so that's what my passion is, to try to help make sure everyone understands what their options are. And that's what I also love about Women Unlimited, is that we're all out here trying to empower one another, guide one another through this process. And I love your channel, that you're trying to not only spotlight small business owners, but we're all here trying to help one another through this process, and try to understand some of the pieces of our passions. Some of us may love to make jewelry, or love to go on vacations and help other people, do those things, not the insurance side or the taxes side, or the business side of things. So we need to really have a tribe of people around us to help us.
Life is way too hard to go at it alone.
Exactly.
And with all of us together, I'm hoping that at least of my part, I'm making a little difference.
Yes, you are. We're so grateful for you.
Okay, guys. Okay, I'm going to tell you right now the special information, and that is next week's episode. I'm going to have Federica Thomas, and she has a Refresh Your Life coach. That's what she does. She's a life coach. So stay tuned for that one. Now, usually I'll tell you that bye and all of that, but not yet. I tell you it's not over yet, okay? Because if anybody is out there looking for work, anyone? I know a lot of people looking for work, and it feels like nobody's hiring. Well, Kayla is hiring.
Absolutely.
So if you stay, excuse me, if you stay tuned for just a little while longer, we're gonna go to the other side of the office, and she's gonna tell you exactly how to apply and what's all entailed with her little small business, and see if this is the right fit for you. Okay? So stay tuned. Don't go nowhere.
So just to let your viewers know about the opportunity to also, if you're interested in being a health and life insurance broker yourself, we are hiring. There is a requirement. Every state in the United States does require that you have your own insurance license in order to sell insurance in any state. So the requirements, are going to be listed by the state of Texas. So there is a course that you can take. There's an all online class, and so there's a little bit of a fee involved, but it's about $200 to $250, and so it's a pretty small fee in order to be able to access a whole career change. And many people decide to do this part-time on the side. You're able to make an entire career change like me and do this full-time if you'd like. But we are hiring. If you are interested in part-time or full-time, we do have multiple positions available. But the position is focused on health and life. You can choose to focus more heavily on just one or the other, but you will get your license to be both a health and life insurance broker. As you already heard in the other part of the interview, there are a lot of intricacies in both sides of that. So you can choose to kind of focus in on one area or be like me and do both. Everything is listed here. There is a QR code listed here on this flyer. There's an application on Indeed that will take you to if you're interested in applying. And I'd love to sit down and go over all the details with you. So definitely check out the application, and we can go over all the details in our one-on-one meeting.
All right. So do they get a hold of you at that same number and the same address?
They definitely can. You can call me, you can email me, put in your application on Indeed. However, I'm more than happy to have an individual conversation. If you have specific questions before you're ready to apply, definitely reach out and we can have some preliminary conversations ahead of time. The compensation is very lucrative in that health insurance is definitely something that you get each month, especially if you're helping on the marketplace, as we talked about earlier. The Texas, because every state, as I explained, I'm licensed in 19 states. Most of the agents come on only doing one state, which is completely fine. So in Texas, it's $25 per member per month. So if you're helping enroll a family of 4, for example, then that's $100 each month for all 12 months.
Oh, wow.
So can be quite lucrative. And then for life insurance, it's whatever the family is paying, because for health insurance, you can do a whole family, right? But for life insurance, everyone gets their own individual policy. And so whatever that individual is paying for their life insurance policy per month, for the most part, the insurance companies pay you out in one lump sum for the first year. And so, you get kind of two different ways. You can have certain policies that'll be a lump sum payment and certain policies that'll be kind of throughout the year payments. So we like to have, that's one reason why many of us do both, so that we can have that kind of salary idea, and then the other of, more of the lump sum payments throughout the month there. So,
okay.
Yeah.
That's awesome.
Yes.
All right. Okay, guys, gosh, that's so great. to work like that? And you say that it's flexible hours?
Absolutely. So for this role, it is a hybrid type. You can work remotely. We have office space here for those who would like to come in and work in kind of a office space, but you can work remotely. You can do it part-time, full-time. It's very flexible in that regard. We definitely have space like this to work, but you can work from home, work from Starbucks, and many of us work with our clients in their home or on, on Zoom, that kind of thing.
Okay,
So.
yeah, that would be good, definitely. Wow, that is so great. That is a great opportunity for you guys. I'm glad that you brought it to the forefront here in your interview. Because a lot of us are looking for work and we can't seem to find anything. And I know a lot of you want to have that flexible kind of thing where maybe an office is not for everybody, but you can work from home.
Exactly.
That sounds great. Okay, thank you guys. Thank you so much for staying to the end of the video. Y'all have a great Thursday. Y'all have a great weekend and get a hold of Kayla Holloway, Health and Life Broker. Okay?
Thank you so much.
This insurance is so important, guys. All right? So, as always, give me a thumbs up and give me a subscribe. Okay, guys? Love y'all. Bye.